Okay, hi George, Dr. Buford, getting started on the right knee here. We're looking in the medial compartment. We can see some areas on the articular cartilage right off the bat that are kind of frayed. And this is what early arthritis looks like. Everything's magnified a lot though, 30 or 40 times on the screen. So these areas look large, but really it's magnified quite a bit. But we can use this shaver, and it has suction attached to it. We just use this to kind of smooth out these areas. And then here's the tear in the meniscus. We'll go ahead and take a basket forceps. We'll try and trim this back to a stable rim. Okay, and then we'll take a pair of scissors and trim out that piece that's been catching, it looks like. Okay, so next we'll put in our shaver. We'll keep working here and show you some more in a minute. Okay, so we've trimmed out the meniscus, both anterior and posterior to the tear. It looks pretty stable. I think we're going to leave it at that. You can see kind of the bottom meniscus, but the anterior portion is okay. Posterior portion we had to trim a little bit, but is still present. And this is an area in the condyle that's a little bit loose. I think we've got that pretty well smoothed out as well. So next we'll look in the central part of the knee. This is where the big ligaments are, the anterior cruciate and posterior cruciate ligament. And we can see the ACL is right here. It looks big and strong. Posterior cruciate ligament is going to be behind this little bit of fat, and that looks okay. That's normal. So next we'll look in the lateral compartment. Pause. Okay, this is the lateral compartment, and it looks like it's in better shape than the medial compartment. There's maybe some minimal radial tearing of the meniscus. You can see some of these loose fibers here, but that's really not too bad. And if anything, just the shaver would take care of that. We don't need to use any scissors. Just whatever comes to the shaver. That looks pretty good. Okay, so I don't see any other loose pieces back here. And we'll go ahead and look at the patella next. And this is your patellofemoral joint. This is the patella up above. And just like on the medial side, there's some damage to the articular surfaces here. As we look in, you can follow this down the front of the knee and see that down here things look pretty smooth. But as we get up and look at the surface of the patella, there's the articular surface. You can see there's some areas where things are a little bit rough. Okay, so we'll smooth these out just like we did on the medial side of the knee. I need a big metal cannula for a minute. And if there's anything else that we do surgically, we'll come back up on the video, anything else significant. But otherwise, I think we're pretty much done. We've seen everything we need to see, and hopefully this will get you some relief and get you back doing everything you want to do without pain. So good luck to you now. Bye-bye.